So my migraine symptoms will extend beyond just the pain of a headache. I get severe nausea and sound and light sensitivity, brain fog, word finding and memory issues, dizziness, and numbness issues. And so those who know me can look at my face and just know when I'm not having a good day. And I'm sure this sounds very familiar to many of you. So migraine will be like a group project for those around me that they're forced to participate in often. I am, by occupation, I'm a clinical professor and audiologist at ASU, and so most of my practice is complex vestibular and cochlear implant patients, and so I've had to develop a lot of compensatory strategies for my teaching and my clinical practice to work around things on days where my brain just isn't working so well, and there's some days where it just doesn't happen. And my husband and my children are wonderful about picking up the slack, but migraine can be a disruptive companion on family vacations and holidays. And my daughter, when she turned 16, knew that she'd be joining the family rotation of driving me to infusions, and so that's kind of how it goes. The burden of patient work is also a very real thing. So it can be very easy to start to feel like a human pincushion after a while. And then there's the added time of sorting medication and making sure I have all my backup options when I go on a trip, staying on top of appointments and insurance issues and communicating between providers in relation to my other issues. And so that can be emotionally tiring, and it just takes a lot of time as well. However, I've started to realize the value of advocating for my own conditions in the same way that I do for my deaf and hard of hearing and balance and vertigo patients, in terms of participating in events like these walks and the Act Now training and Headache on the Hill. And through those types of things, I can win back some of the power that's been taken from me, through those times of not being believed and such. There's also a lot of overlap in the migraine population and my vestibular population at work. And so while I cannot medically diagnose migraine or vestibular migraine, I've been able to use the knowledge in my toolbox from these different advocacy events to help recommend that patients go see a headache disorder specialist when they express frustration about the impact of their untreated or undertreated migraine. And then the last few things, through my own personal experiences and seeing students who have opened up to me as I've been willing to share more of my story, I see the impact of disability in the work and school environment, and so have started a research line about clinical education in our allied health fields for students with disabilities and improving our clinical accommodations. And then in the midst of all this, I really try and remember the positives as well. So I have the privileges of health literacy and great insurance through the state, and the financial resources to navigate the system, but I recognize that many don't. And my kids have developed a unique empathy towards disability that many teens don't have, and I recognize that as a great blessing as well. So I thank all of you for coming out here and advocating with us today, and I hope you have a wonderful walk.